Good day, everybody. Welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. Today, the topic that we're going to be covering is utilizing Isolite with bonding. Good morning, Dr. Hirsch. How the heck are you?
Good morning, Rolando. Well, it's Tom's Tips at 10:03 because my internet just sucked this morning and I couldn't get the dang thing to work. And anyway, technical difficulties with the wind and all that. The internet was down. I'm great. So what are we going to talk about bonding today? Utilizing how Isolite helps you when you're doing something as simple as bonding. I mean, that's a pretty easy deal to do.
So there are, if I understand correctly, there are multiple steps. There's the prep, the etch, the potential for placing a matrix strip if necessary, and then things like placing the composite, curing, and that. So what are some tips for each of those steps? On the etch, what tips would you give regarding Isolite and etching?
Okay, that's a great question. Well, let's even back up before the etch. Let's go to the prep part of this whole thing. In fact, Tom's Tips, let's take number 30. MO composite on number 30. That's really easy to do. Are we live? My computer's just frozen right now.
But we can hear you. Keep going. I think we're good.
Is everything? Can you see am I waving at you?
No, I can't see you, but we can hear you. So
okay, because I'm just dead in the water on this end. So anyway, an MO composite on tooth number 30. What we end up doing a lot of times is I do an intraosseous injection. So I'll put the Isolite in. I'll give a little bit of local anesthetic, and then with a product called the Peerless. It's made by a company called Peerless. It's the Stabident injection. I will actually make a little injection of perforation between the first and second molar. You go right at the papilla, and you'll just give a little drop of anesthetic at the papilla, and then you take a perforator on the end of a slow speed handpiece with water and perforate the cortical plate in between the two teeth. You have to make sure there's enough room interproximally. So when you do that, you have the Isolite in place because you are using water to make sure you don't overheat the bone, and the Isolite will actually evacuate the water while your assistant can be there spraying air on your mirror so that you can see better. So that's tip number one, just the anesthetic part.
So water to keep it from overheating.
Yeah,
it'll evacuate it, right? Cool.
That's right. Because if you overheat the bone dies and then it sloughs off, and that's just a real mess. How do I know? I've done it way back early on when I was first doing intraosseous injections. I overheated the bone and the bone would slough off. It become necrotic, and it was just a nightmare getting this area back to a good, healthy state. Oh, here we go. Now I can see we're moving again. So that's number one. Number two, in the preparation phase of utilizing Isolite when you're preparing this tooth, it's real nice because you can actually concentrate on the preparation. The tongue is not in your way at all. And you can just use your mouth mirror to pull the cheek out of the way. You can see what you're doing. You can work directly and you can just see what you're doing. You can use plenty of water. The great thing about this, when you've got the Isolite in the mouth, is your assistant now has the ability to get everything set up for the procedure so she knows what you want next. And all you have to do is, if you've got a great assistant, is stick your hand out and whatever you need is in your hand. It's nonverbal communication. And this is really nice for the patient because at the end of the procedure, they're going to say, God, you guys are such a great team. You didn't even talk to one another. When you've been working long enough with your assistant, you've got a great assistant, you don't have to do anything. I mean, for me, if I go like that, that's a cotton plier. If I go like that, that's anesthetic, or that can be some astringent if I have a little bit of bleeding. So nonverbal communication is really nice when we're doing all of this. So
because the Isolite is in the mouth, it gives her the ability to focus on your cues as opposed to it being in the mouth, correct?
Exactly. And you talk about nonverbal communication. We have nonverbal communication with the patient because the patient can't talk. And so that's kind of fun. When the patient doesn't talk, the procedure goes faster. And so that's really nice, the nonverbal aspect.
So on etching, what are some tips regarding?
Now we've got the Isolite placed. Now, here's a trick that you should all do. If you've got any bleeding at all, or any lot of clavicular fluid coming up, then I want you to take that time to assess what's going on there. You may want to remove the Isolite and put a rubber dam on if you can't control the bleeding and if you can't control the Isolite, because I want you to have a great restoration. And the Isolite is not going to do anything for you in the aspect of controlling circular fluid or controlling bleeding. That's up to you. So if you have the Isolite in place and there is any circular bleeding, take some astringent, put some astringent on the tissue to stop the bleeding. And also you might put a little bit of retraction cord right down in there to stop the bleeding. Or take the Isolite out and use a rubber dam. We've all learned how to do that in dental school. It may not be your go-to choice, but to get a good restoration, it's well worth it if that is the case. So let's make the assumption right now that I have chosen not to use a rubber dam and I actually have some circular bleeding. I'm going to take a couple of pieces of Ultradent retraction cord, Ultrapack retraction cord, dip it in some astringent and place that in the crevice. And then I will put my matrix on, whether you're using a circular Toffelmeyer matrix or whether you're using a half matrix with a wedge and a stainless steel occlusal clip. I don't even know what the thing's called that separates the tissue. You can use that too. And the thing that's nice about this, once again, is everything is dry and out of the way. So now once we've got that done, we're going to etch the prep. I'll put my etch on, I'll leave it for 30 seconds. And when we rinse the etch off, I don't have any additional suctioning going on. I just let the Isolite suck up all the rinse. The patient doesn't taste it. It doesn't get all over the tissue, or anything that gets on the tissue is totally diluted immediately with water. So that's the next thing that we do, is you don't need any additional aspiration when you're doing the etch. You still there?
Still there. We can hear everything you're saying. Yeah. You've got a wonderful face on, but keep going. It's good stuff.
Yeah. So I see the face. Oh, yeah. Look at that one. Okay. So yeah, it's just the internet today. Okay. So then let's go ahead. Now we've got this thing isolated. We've got the matrix on. Next thing, if you want to desensitize the tooth, you can use a little gluma on that tooth for any desensitization, and then put your bond on. There's all kinds of bonds out there. I'm not going to make any recommendation of one over the other. They're all great. But if you put your bond on in a nice controlled environment where you've controlled the humidity, you've controlled the moisture, you're going to get a great bond to the tooth, which is going to then bond to the filling. So the Isolite just keeps everything at the right amount of humidity. And by using the controllers, the little levers right at the corner of the mouth, you can control the amount of vacuum that you get, because you don't want to over dry or desiccate the tooth. So make sure that you're giving it just the right amount of vacuum in there, not too wet and not too dry. And put your bonding on. Clean it off. Here's another nice thing about this. I'm going to get that in a second. Then you cured your bond with your light. Some of these bonding agents just go off at lightning speed, and so you may have in your operatory the ability to have an amber light in your overhead light, but that's what Isolite does too. Is we actually have a CureSafe in the i3. We have a CureSafe light. So by pushing a button, the lower button on the Isolite, it will change it from a white light to an amber light. So it will not set any cement, or it will not set any composite whatsoever. So that's a key factor in the i3, in the latest version of our Isolite, is the CureSafe light. You can take all day bonding and all day cementing, and it will never cure any composite or bonding agent or cement whatsoever. So that's a huge tip. And then after you placed your filling, go ahead and remove your matrix and use the Isolite. We'll keep the tongue out of the way so you can do any occlusal adjusting that you have to do, or any contouring. If you're coming from the lingual aspect, sometimes by pushing the Isolite back further, that's tip number 4, pushing the Isolite back, the bite back further in the mouth, that'll give you more access on the lingual, so you can actually bring the handpiece in from the lingual, do any contouring from the lingual. And sometimes there's not enough room, take it out.
Very good. So first of all, I appreciate it. Your video has frozen, but I can hear everything you're saying. So hopefully we'll work through the technical issues. Yep. So if I understand correctly, the system gives you direct access to the tooth. It gives you the ability to kind of work in the area without dealing with all the other things. Any tips with regard to polishing or shaping that other than moving it around? I guess moving it around gives you
moving
the
it.
room.
Yeah, here we go. Now we're live again for some reason. No, if you're going to move it around, push the bite. It's froze again. Push the bite black more distal. That will give you room for polishing and shaping.
Awesome. Well,
Yep.
hey, first of all, Dr. Hirsch, thank you so much for kind of pushing through this.
Yep.
Believe it or not, you've done probably 40 or so tips. This is the first time that your video kind of got whacked out. We'll figure that out. Hey, folks, every Tuesday at 10, Dr. Tom gives us tips on how to use Isolite in different
Look, and
procedures.
now our video's back up again. Who knows?
I know.
It's windier than all get out here in Malibu. So maybe the winds are dealing with the power lines or the internet. I don't know. Anyway, everybody, come back again and take care.
Yeah, if you like this content, please share it. If you have questions, please let us know. Thank you, Dr. Hirsch. So appreciate that. Have a great rest of your week. We'll get this worked out. We'll see you all next Tuesday at 10.
Next Tuesday at 10 and not 10:03. Bye-bye.
All right. Bye-bye.